Dear students, Assalamu alaikum. Today I am going to deliver a topic for class 12th subject zoology. My today's topic is medical termination of pregnancy, abbreviated as MTP. So for this MTP is concerned, it is a very important topic so far your examinations are concerned. Now MTP or medical termination of pregnancy is basically the deliberate or induced termination of pregnancy prior to the age of fetal viability. Medical termination of pregnancy is performed by a qualified gynecologist at a government approved medical facility. MTP is legalized in India and is governed by the MTP Act 1972. Now, we will discuss about the grounds upon which MTP is recommended or indicated. These grounds upon which the MTP is recommended are broadly classified into three categories. Number one is medical grounds, number second is social grounds, and number third is eugenic grounds. So far the medical grounds are concerned, if there is a potential physical or mental danger to the mother due to the continuation of the pregnancy, then MTP is recommended on medical grounds. Now, so far the social grounds are concerned, MTP is recommended if the mother is a rape survivor or the pregnancy has resulted from the failure of contraceptive devices or methods, that is unwanted pregnancies. For unwanted pregnancies also the MTP is recommended on social grounds. The third reason is eugenic grounds upon which MTP is recommended. So far the eugenic grounds are concerned, if there is a substantial risk of the child being born with some serious physical or mental abnormalities such as some hereditary disorders or some congenital malformations or any other possible danger to the fetus, then the MTP is recommended by a gynecologist on eugenic grounds. After this, we will discuss a little bit about the methods of MTP. So far the methods of MTP are concerned, they are relatively safe during the first trimester. So MTP is relatively safe during the first trimester, that is up to the 12 weeks of pregnancy. Second trimester abortions, that is the MTP after the 12 weeks of pregnancy, are called as second trimester abortions. They are riskier but are legally permitted, and generally MTP is restricted to the maximum of 12 weeks of pregnancy. Now these methods are broadly classified, as you can see, the methods for first trimester and the methods for second trimester. So far the methods of first trimester are concerned, they include dilatation and suction evacuation or menstrual regulation, or also there are also certain medical methods for first trimester MTP, in which a gynecologist can use certain medicines that cause abortion, such as some prostaglandins or mifepristone. Now the methods for second trimester include surgical evacuation, also known as DNC, that stands for dilatation and curettage. It may also include extraovular installation as well as extrauterine methods. Now, the implication of MTP Act. In India, the MTP Act was adopted as a health measure way back in 1972. Around 50 million MTPs are performed globally per year, and nearly 15 million MTPs are taking place in India annually. Obviously, MTP has a significant role in decreasing population, though it is not meant for that purpose. Now, there are many drawbacks associated with MTP because the repeated abortions or MTPs are not conducive to a woman's health. Hence, MTP should not be considered as a birth control measure and in no way should replace prevailing methods of contraception. Secondly, even in the best circumstances, there is a small inherent risk in the procedure of MTP, and this should serve as a warning that MTP can never be as safe as efficient contraception. And another dangerous trend is the misuse of amniocentesis to determine the sex of developing fetus. Usually in India, if the fetus is found to be female, it is followed by MTP, that is female feticide. And female feticide is totally against what is legal. Also, the death of pregnant mothers due to the illegal abortions is 500 per 1 lakh pregnancies. And nearly 20,000 women die in India annually due to the complications of unsafe and illegal abortions. These deaths usually occur due to excessive hemorrhage, sepsis and infection, severe anemia and gut injury. This mortality and morbidity increases with each week of gestation and is 5 to 10 folds in the second trimester as compared to the first. The late effects of MTP include infertility because of the tubal infection or tubal blockage. It may also lead to ectopic pregnancy or pelvic inflammatory diseases, abbreviated as PID. Finally, I would like to conclude the topic with a remark that MTP service is available in India as a health measure to avoid criminal abortions and not as a contraceptive technique. Its indications are clearly defined by the government and should be strictly abided by the gynecologists. Thank you very much.